Hi, my name is Keith Appleby. I'm the Kaizen Promotion Office and Clinical Pathway Head, and I nominated my team, so none of them are capable, they're willing to come along and present, so I've been asked to do the presentation. What I wanted to present is about our journey, and this is entering year 6 of our lean journey in using the lean system as a whole system approach to transformational change in our organisation. We are a specialist mental health trust, and we do cover quite a large geographical area with a population of 1.6 million, with urban and rural areas, and that's just a map of the areas that we cover as a specialist trust. I brought this, and this hasn't gone out for release, so other than directors, this hasn't been seen by any staff in our organisation. It's the new strategy map, which will be the screen save and the log on screen for all staff logging onto any of our computer systems from April. So all staff will see at a glance. It's about service users, clear, what is the vision and the mission. We did develop a staff compact, a behavioural contract around our transformational journey, and one of those initial components was staff felt that improvement activity may lead to job loss or redundancy, and one of the guarantees we give staff is as a result of improvement activity we would not be making staff redundant, but we would potentially be moving them into other areas of the trust to work multi-process. We have a section of values and behaviours which all our leaders and all our staff are expected to utilise, and those values link to quite clear behaviours which we use in one-to-one interactions. And our strategic goals are all getting tweaked, so this is enabling us to relaunch our strategic goals. We do, like most lean systems, have a house or a temple or an institute or a club or a CUI. We developed our house with patients at the centre, but very much working with our host organisation. We use Pure Toyota Production Systems by Virginia Mason Seattle. Virginia Mason Hospital developed the MPS, and they helped us to actually start our lean journey 6 years ago, and I'll come on to that. And this year is the first year where we've started using what we call Hush and Cannery planning, where we've got the board setting the strategy and process owners starting to look at how we're actually going to deliver against the strategy. And within Hush and Cannery, all our staff should really clearly know their role within delivering our strategic direction. So that's our start of using Hush and Cannery. We do a comprehensive training programme in relation to how we get staff engaged in using lean methodology. And we do use 3 key philosophies which we learned from Virginia Mason just in time, so we have just what we need in the right amount at the right time, and that's reflected on a number of projects, and mistake-proofing, improving safety. But key is using continuous improvement to continually taking waste out of our systems, as much waste as possible, and we link that to Tachiono's 7 wastes. That's my Kaizen team. We started 6 years ago as a team of 5 staff. We've had progressive investment from the trust, and the team will move into being 22 staff supporting continuous Kaizen training activity and supporting some of the programs that we run in relation to delivering our service, our quality improvement system, TQS. Kaizen activity we support, but a lot of Kaizen activity is done by those staff we've trained in using the tools and methodology and sits outside of my team. We used the methodology to develop what we called a rapid pathway development workshop. We did, like most NHS organisations, spend 3 or 4 years in committees deciding how to develop clinical pathways. We now do a 10-week run-in, we do a 5-day event, and at the end of that we have the clinical standards and the pathway built. We're starting e-pathway development this year and variance reporting on our e-pathways the year after. We've worked collaboratively, and I'll come on to our conclusion around how we work collaboratively with a number of organisations, and we've now started training external NHS organisations in using Virginia Mason Production Systems, which have now progressively moved into TQS and by the North East Transformation Systems. Our journey started in 2007 when Virginia Mason were training some of our key staff and also coming across to visit our organisations. We continued training certified leaders from 2007, and we had 7 certified leaders. Virginia Mason coached us, coaching and training other staff in our organisation, so we started to build capacity. But of the 7 leaders, 3 of those were board members. So board members were trained as certified leaders to run improvement workshops. We've continued our trajectory growth, continue with our partnership with Virginia Mason in Seattle with visits, and building the number of certified leaders in the trust up till the present time. We currently have 62 certified leaders in the trust. That's all our board members, all heads of service, all associate directors, and they all lead RPIW improvement activity workshops on an annual basis as part of their recertification programme. So it's really powerful when the Chief Exec is workshop leading. And about 4,700 of our staff have participated in workshops delivering transformational change or improvement through the training. We have continued over the last 3 years to maintain what we call our teacher relationship with Virginia Mason. They send across 3 times a year one of their senior executives who observes our process from board level through to our improvement activity to verify that we are staying true north to using Virginia Mason production systems as a key driver in relation to our improvement activity. All board members are trained. We do work closely with VM. We did develop our compact, our behavioural contract as an organisation with staff. We do link it into our Band 7 and above values and behaviours training, and all our Band 7s, as a mandatory requirement, have to go through a 3-day values and behaviours training in relation to our organisation and using the QIS methodology. And we started Horsham and Canary in our leadership this year. We run a number of training programmes. The main training programme for Certified Leader, this one here, it's a 6 months to a 12-month training programme, and they have to learn all 21 modules of Virginia Mason Production Systems. There's a verbal viva to test that they can teach it, which is a pass or defer. Then they have to workshop and team lead 2 rapid process improvement workshops, including a 6 weeks gathering of metrics before the improvement activity. And our board members went through that process. We didn't defer any board members. They were quite anxious about passing and not being deferred, so they really put a lot of effort into using the methodology quite clearly. There are training components. We do link in with VM for their fellowship programme in Japan, and I was lucky enough to go last year to work with Shingazitsu around intensive Kaizen activity. We do have a Certified Leader programme, which is 6 to 12 months. We started training medical staff because medical staff wanted a more tailor-made training programme where they could opt in and be accredited for completing modules. So currently, out of our 236 consultants SPR grades, there's only 9 haven't commenced this programme, and a number of medics are now certified leads and running their own improvement activity as part of continuous Kaizen. We do training for leaders, Band 7, and they have to be nominated by a director level post who's willing to coach them and mentor them, and they have to be a certified lead coach or mentor. And they do a 6-week training programme, which is 5 formal half days, but bring a project from their department, which they then have to deliver, measure at 30, 60, 90 days, and then they do a re-measure at 12 months, at which point they report to our monthly report out, where all our improvement activities are reported out to board members and non-execs and invited guests. We also train admin staff in 7 of the Virginia Mason modules, and that starts around some of the basics 5S. But some of the admin staff have delivered some fantastic improvement activity as a result of their training, and really took on board 5S, setup reduction, Kanban, and implemented a huge amount of activity in their areas. And we feel it's an investment in sending staff to Virginia Mason, particularly those staff who need to be buying in to using the way we do it. And we're at the point now where this is the way we do it. If you don't like it, go and work somewhere else. And I think that's the point we're at in our journey in relation to recruitment. That's just a training summary in relation to QIS for Leaders, Certified Leaders by Durham and Darlington locality, Tees, North Yorkshire, some of our forensic divisions, but also our corporate services have a number of trained staff who now run their core KPO facility, Kaizen activity, internally without support from my team. We've completed a bit of activity since we started the journey. We've done 100 rapid process improvement workshops. And when you consider they're not a cheap option for delivering transformational change, when you're releasing staff, managed by a process owner, sponsored by a director level, 4 planning meetings, a scoping meeting before the event, 6 weeks observations, 5-day event, and then remeasured at 30, 60, 90 days and 12 months to guarantee sustainability. They are quite an expensive process, and we target them at some of our high areas of activity. QIS for Leaders is that individual Band 7 and above who have a project, and I think 113 projects have been delivered by them, again measured as part of their training. QIS for Admin, share and spread. When we've got something which works, we like to share and spread it. We don't drop it on people or impose it. We say, this is what we've done, we'd like you to implement it, but can you do better? That continuous Kaizen thinking and methodology. Kaizen activity run by my team is 26, but a lot more goes on externally, that continuous improvement activity. And we did start using 3 years ago a process called 3P, which is more of a radical design process workshop. So we've done some quite major redesign using a 3P process. I've got a couple of examples. And pathway development. We did manage to develop 12 robust clinical pathways, which took both previous organisations 24 months to deliver nothing. So we got no pathway development through committee. That's just 2 RPIWs, and as I say, we've run 100. But Children and Young People Service, from the start of the baseline monitoring on one metric, which was Children's Services lead time referral to assessment post RPIW, significant trajectory managed by the team manager who was the process owner. And I showed a smaller baseline, NHS Memory Service, 30 days post-event, and they actually managed their waiting list and reduced significantly the access to the service, from the previous, which was 70 days plus, to just under 30 days post-event, so really significant impact. We used the 3P production process. Some of them have been around design, and this is one of my favourites as our workshop led. 22 clinicians, 3D model built a new unit. We went to the architects who designed it, and then they built it and they occupied it. So we were quite pleased staff designed a building using some of the lean methodology around 3P. It's quite revolutionary. We designed our policy framework the same way, and we also designed our clinical record using a 3P process. Some of the clinicians and consultants do struggle with what they call the Blue Peter part of the workshop, but quite quickly buy into it. Clinical pathways, as I say, we've developed 12. We moved into e-pathway this year, and we moved to variance reporting in 2015. Share and spread, we do a lot of share and spread events. High dose antipsychotic treatment we implemented across the board in our trust, because we were one of the 10 worst trusts in the UK until we did an RPIW and then spread it, and then we went into the top 10 percentile on patient safety in relation to high dose. Partnership working, we work now with 3 organisations, or 3 groups. First one was Darlington Dementia Collaborative. We trained certified leaders in the local authority, the PCT, and the acute trust, and then we focused on improving services for dementia patients. We've done the same in Harrogate with North Yorkshire County Council, Harrogate Acute Trust, and the local GP practices, the CCG. And we've just started a new project training staff in Teesside with the Acute Trust, 2 local authorities, ourselves, and both CCG groups. And the RPIW activity, the first one of them was last month. And we've gone back to the partners in Darlington with them, and we're working on long-term conditions. With the staff we trained in use of this methodology, we started to work through long-term conditions and use the improvement process, the RPIW, the Kaizen activity, to impact on that. And we had some major successes on all those collaboratives to date. Continue with partnership, as I say, those are the ones we've been working on, so quite a good partnership building of sharing what we've learned and some of the skills as trainers. But we've also started working very much within the North East. We were one of 7 partners trained in North East Transformation Systems. There's now 12 partner agencies across the health community as part of either affiliated or associated to the North East Transformation Systems. But we are one of the primary partners, and we did help them with the Health Foundation bid, which brought in 450,000, to develop a regional model for 3P. We've developed all the new teaching tools with the North East Transformation Systems, and the IP agreement has been transferred from Virginia Mason to us. So the new teaching materials were developed by us based on Virginia Mason and used by us. As a trust, we give a free external visit, and we've had 19 external visits since we started this 12 months ago, and teams can come and visit us. They will tailor-made the visits if they want to look at whatever service improvement we've been involved in. And we've now started working with 3 external NHS partners in certified leader training, coaching them through their RPIWs and starting their lean journey. So the success that we felt as part of our Lean Champions was, having learnt it ourselves and used it, we're now starting to help and share with other organisations outside our trust. Onwards, we're using Hoshin Kanri, as I say. This year is quite radical. We've taken model line development by constructing a team outside of the clinical area, and until that team's perfect, we won't feed patients through it. That's a 24-month, quite intensive project which the Trust invested in. And we link that to some of our mother factory development. When we've got this perfect team running and it actually works with patients flowing through it, we'll use those staff that we've developed into this model line to support the model line rolling into other areas. Very much like manufacturing does with developing a perfect factory, and then staff from there go and support the next factory's development, and staff from the next factory come and work in the perfect model line. So we're starting out this year, which is quite a radical approach for us. We've got another 4 years of the original 10-year commitment by our board, and to date none of the board members have fallen out of their recertification programme, and you can't underestimate the power of the chief exec being a workshop lead. It often is a coach for some of these, stopping the chief exec being the chief exec and reverting to being a workshop lead. So that's one of the difficulties you have when you have quite senior staff. But we do target them against some of our big problem areas as workshop leads. We continue with further partnership and collaborative working, and we will work with NHS organisations and non-NHS organisations. And my team's growth has been a team which initially had to be a very small team, but we've had lots of staff joining us from manufacturing, from acute settings, from CCGs, from SHAs, who all are passionate about using lean methodology in health. And that's that. Any questions?
Can you just give a bit more detail about the model line, the mother factory analogy, like in plain English?
We support some of our community teams.
Yeah.
So what we've agreed to a trust is we will put in a project where we look at the whole element of teams, leadership, how the teams run, the pathways. We start with the pathways. Then we'll start looking at recruiting staff into the model line. So we only recruit those staff that will be able to work with the new process. So we'll really be looking at staff skills, using skills matrices. And until we build the perfect team, we won't be putting any patients through that perfect team. Now that will be a perfect team model. It'll be leaned, using all 21 modules. It'll be just in time, single piece flow, no waste. And until we get to that point, we won't start using it on patients. But it will be a fully operational team that we've developed from scratch as a team, but with no patients.
So you don't pilot, you don't test?
No, don't pilot, don't test, we build.
I still can't, I'll have to come talk to you, I still can't quite get my head around how that works.
If we had a team, we did some improvement work on it, working with existing staff. With a model line, you've got a blank slate, and you build it up from the start.
Yeah.
So we might build it up in cardboard cutouts. This is what we need. We need an OT, we need a physio. We don't need an OT, we need a physio. We need a manager who's transformational and transactional. We don't need an autocratic manager. We need to have the My Ideas strategies involved, so staff are continually improving the process. And you build it as a virtual team, and then employ staff to work on that virtual
and recruit
team.
according to the skills and
once you've
knowledge
built the staff element of that virtual team, then you feed a patient through to see if the patient process works.
Could I just ask, is that recruitment internal recruitment or is it external?
Will be internal and external. We're looking externally for the project manager, as it's a real high level post to project manage the 24-month programme.
So do you always use an external project manager then? Don't you look to
No, we recruit.
Don't you look at the skills of people that are in the organisation?
We don't have any staff skilled at that level for a model line development at the moment. It's the first model line we looked at developing, and we're really looking for somebody who's going to be like radically
so where would that person come from then, do you think? You know, what background?
Obviously with a very, very robust lean background. Could be from manufacturing, could be from health, could be from a partner agency. Could be one of our directors.
Yeah.
Any more questions?